And we had a posted agenda, which I'm going to briefly review. So the first order of business is to approve the minutes from the last two meetings in December, which we'll do in a moment. Then before we get into the discussion, and this meeting is really a special meeting. We have our regular meeting, January meeting on Thursday. This is a special meeting to discuss and decide on whether or not to mandate masks in indoor public places in the town of Reading. So before we start into that, I'm going to make a few opening comments to maybe set the context, and then Ade, our health director, will also make some additional comments, at which point we'll open it up for public comment, and then following that, have a board discussion and have a vote on this. And so that is the plan for this evening. I welcome everybody. It looks like we have some great participation from the community, which is always helpful to get input and to understand different perspectives. So looking forward to that. In terms of the first agenda item, the board members got the minutes from December 2nd and December 27th. Were there any changes or suggestions to those minutes?
I had no problem with either set of minutes.
Okay. Carrie, looked okay?
I had no issue. Yep.
Okay. I did not have any problems as well. Again, nicely done by Jackie. Always.
Thank you, Jackie.
So I'll make a motion to approve the minutes from December 2nd and the 27th. Do I have a second?
Second.
Paula, second. Roll call. Harry?
Yes.
Paula?
Yes.
Rick, yes. Okay, so the minutes are approved.
And thank you, Kevin, for sitting in for me when I was out.
No problem, Paula.
Okay, so I'm gonna see if I can share my screen here. I have about a half a dozen slides that I'd like to review with the board and the public to set the context, because I think in having any discussion, it's always important to set the context. So just a little history. This board, maybe not all the same participants, in March of 2020 did authorize a mandate for mask wearing in indoor public places. Actually did it a few days before the state mandated it. We rescinded all COVID mandates back in June, at the time when it seemed like the cases were very low and it seemed like we were getting through the end of the pandemic. We have discussed mask mandates the last 3 meetings as I look back in the minutes, going back to October, but have not made any motions or decisions around them. We did email to food establishments and businesses in October, asking them, to post something at their entrances that we strongly advise the use of masks, but we did not mandate it. And then we had public comment in November and December meetings where 2 residents did advocate for a public indoor mask. So that's how we got here tonight, is to really have a final discussion on what to do about mandating masks in indoor public places. Currently, the Mass Department of Public Health strongly advises indoor mask wearing in indoor public places. It actually does mandate it in certain circumstances, like public-private transportation, healthcare facilities, and so forth. The CDC strongly recommends it in counties that are considered to have high, moderate, substantial, or high COVID activity, which would include Middlesex County. And it's been in the news that it's strongly mandated by the Mass Medical Society. In fact, the Reading Library mandated indoor masks back in September as this current wave was starting up. There is no municipal building mandate for mask wearing, but it is strongly advised and for both employees and visiting residents. When we think about the status of COVID activity, the numbers from last Thursday show that in Reading currently we have 232 active cases as of 3 or 4 days ago, which is the highest we've seen in a long time. If you look at the state data on the state website and look at the 14-day average daily incidence of cases, basically this is the graph that shows that. So back in September, we were down, actually for the first couple, for September and October, we were down in the 20 range, but beginning in November, it's really skyrocketed up. Similarly, the MWRA actually measures viral material in wastewater. And it's been shown over the past year that this is a good indicator of future activity. And so I pulled out a graph from the MAPC looking at, this is going back to March of 2020. And this was the second surge. And here is September and October. And this sort of significant increase has only been in the past week or so. And that portends much more activity in the month of January based on past history with this data. I did look at trying to compare, and Ade had sort of raised this discussion last week, to try to compare communities where there is an indoor mask mandate with, and there are 25 communities currently who have that, and compare them with 18 communities sort of surrounding Reading, a couple towns out in our general area, and looked at their average daily incidence. And what you can see is that the 25 communities here that have had indoor mask mandates have generally a lower incidence than the 18 communities around Reading, including Reading, that do not have a mask mandate. Obviously, there's overlap there, but I think most of us could see that there is a difference. And in fact, there have been studies, or at least one study done across the country looking at counties that have mask mandates and those that don't. And the incidence of COVID in the ones that do are, the incidence is lower. And finally, there are pros and cons. We've discussed this last week. We've discussed it in the last couple months. The sort of arguments for it is that it's another mitigating factor to reduce the spread of COVID. We do have in businesses and food establishments, a lot of the mitigating factors that were built a year ago. There's distances getting to the cashier, there's better ventilation, there's a lot of plexiglass barriers up and so forth. So this would be one more mitigating factor. It's been proven effective in studies. It's added protection for the most vulnerable. And even though even if it's not strictly enforced, the fact that it's mandated, I think will, increase adherence to it. And it supports business owners who want to do this, but would like the board, to be stronger around it. But there are cons of wearing, to be fair on both sides here, there are cons of wearing it. It is an inconvenience to businesses and residents who are not already using masks. To some extent, it could inhibit business in the community if people feel strongly they don't want to wear a mask, and we've mandated it. We have limited abilities to enforce it effectively. And I think the fact that there isn't a statewide mandate has been, a sort of major factor in not considering it, because we do not live in isolation. We live in a very suburban, almost urban area, and there's a lot of cross business and commuting back and forth. So, there are pros and cons to this. What I'd like to do, so those are really my thoughts about why we're here, and what are some of the pros and cons. I'd like to turn it over to our health director, Ade Solarin. He has some slides and comments as well, and then we will open it up to public comment. So Ade? Jackie, you want to put the slides up?
Good evening, members of the board and the general public. My name is Ade Solarin. I'm the health director for the town of Reading. I am here to discuss information about the potential mask mandate. Next slide, please. All right. Amid rising COVID-19 case numbers, the Board of Health is discussing whether a public indoor mask mandate should be implemented for the town of Reading. Next slide, please. I'm sure you've all heard this before. You've heard it time and time again. One of the easiest and most effective ways to limit the spread of COVID-19 is by wearing face masks. Next slide, please. This image right here is from the National Institute of Standards and Technology. The image illustrates airflow when coughing with and without a mask. On the left, the picture on the left shows that when you're coughing without a mask, the particles travel farther. And the picture to your right shows that masks can partially block exhaled respiratory droplets, which are thought to be the primary way the virus spreads. Next slide, please. All right. This slide pretty much shows how the level of transmission if you're masked versus unmasked. So I'm going to start from the bottom. The orange indicates somebody that has COVID-19 infection. The blue indicates someone without the infection. So if you have COVID-19 and you're masked and you're 6 feet away from an individual who doesn't have COVID-19 but masked, the transmission is very, very low. If you have COVID-19, you're masked, and you're less than 6 feet apart from somebody who doesn't have COVID but has a mask on, your transmission is low. If you have COVID-19, you have a mask on, and you're less than 6 feet apart from somebody who doesn't have COVID without a mask on, the transmission is medium. If you have COVID-19 and you're less than 6 feet apart from somebody who doesn't have COVID-19 with a mask on, the transmission is high. And if you have COVID-19 and you're less than 6 feet apart from somebody without a mask on who doesn't have COVID-19, the transmission is very high. Next slide, please. Based on the data we are seeing, it does appear that municipalities with indoor mask mandates, on average, they've had case counts increase at a lower rate over the past month than those without mask mandates. Next slide, please. So if we look at the 2-week case count for the town of Reading, for the 2-week period ending December 25th, so that will be the top line. The case count for Reading was 281. We had 281 cases. For the period ending December 18th, we had 214 cases. For the period ending December 11th, we had 239 cases. And for the period ending December 4th, we had 231 cases. Now, if we consider the same data for a town like Winchester, Winchester has always had the indoor mask mandate in place. We can see that the case counts increases at a lower rate when compared with the town of Reading. So for the town of Winchester, the 2-week period that ended December 25th, they had 166 cases. Reading was 281. For the period that ended December 18th, they had 121 cases. Reading was 214. For the period that ended December 11th, they had 113 cases. Reading was 239. And for the period that ended December 4th, Winchester had 97 cases and Reading was 231. Now, if the board votes to put in place a mask mandate, is the town of Reading going to get the same outcome? The answer to that is most likely the town of Reading will get the same outcome. Next slide, please. So I would like to share some myths about masks. These are individuals that I have actually talked to, and we've had healthy conversations and debates about masks. And the first one is masks don't work. And the fact is collectively, most science experts agree that masks are likely to reduce the transmission of coronavirus and should be used by members of the public when around other people. The N95 masks are the best type of masks because they filter 95% of particles. Surgical masks are also 95% effective, and the cloth masks are between 50 to 80% effective. Next slide, please. Next myth. Wearing a mask causes a dangerous buildup of carbon dioxide if worn for long periods of time. And the fact is that prolonged use of medical masks can be uncomfortable. However, wearing a mask is a safe practice. It does not lead to carbon dioxide intoxication nor oxygen deficiency. There is no science supporting this statement. Healthcare workers have been wearing masks for prolonged periods of time without incident. Next slide, please. Oh, it is dangerous to wear a mask when exercising. Fact, exercising with a mask on is safe. It might feel uncomfortable, but it's safe. Next slide, please. Mask use causes delays in speech and language development. Fact, there are no known studies demonstrating that the use of a face mask negatively impacts a child's speech and language development. We understand that a key part of learning to communicate for a child is watching faces, mouths, and expressions of people closest to them. However, visually impaired children develop speech and language skills at the same rate as their peers. Next slide, please. I don't need to wear a mask outside. You can't catch the virus when you're outdoors. Fact, likelihood of catching COVID-19 outside is lower, but it's not zero. You should still wear a mask in outside areas where physical distancing isn't possible. There have been plenty of cases, examples of outdoor gatherings becoming super spreader events. Next. You don't need a mask if you're fully vaccinated or recovered from COVID. Fact, when the COVID-19 vaccines were first administered, The CDC and the World Health Organization changed their guidelines to say that those that are fully vaccinated did not have to wear masks anymore. However, those guidelines changed when the highly contagious and deadly Delta variant spread through the nation, causing breakthrough infections. Now, both the World Health Organization and the CDC recommend that everyone, vaccinated or unvaccinated, wear masks while in indoor public places. Next slide, please. So in summary, there may not be a lot we can control about the pandemic, and that can feel overwhelming, it can feel disturbing. However, one thing we can control is how we protect ourselves and others, and mask wearing is a key part of that. Next slide. So here are some of the feedback that I got from the residents, and I urge the Board of Health to consider these statements during their deliberation. I've had somebody contact me, I'm in support of the mask mandate, but I worry it will lead to a vaccine mandate. So I would like the Board of Health to, consider that during their deliberation. Another person asked me, if masks are not required in neighboring towns, a mask mandate won't be effective. Also, I had somebody call me, I'm in support of a mask mandate. When I tell my patrons to put on a mask, they don't listen. A mask mandate from the Board of Health gives us leverage. And then I heard from somebody else, oh, you know what? We've invested so much in a state-of-the-art air filtration system. There's no need for an indoor mask mandate. And then I had somebody ask me, I'm in support of a mask mandate, but I'm worried that the mandate will be implemented indefinitely. So these statements right here, I would really urge the board to consider them during their deliberation. Next slide, please. So in conclusion, I would like to leave you with this newspaper article published on December 14th, stating that the Massachusetts Medical Society calls for an indoor mask mandate amid rising COVID-19 case numbers. That concludes my presentation. Thank you very much.
So thank you, Ade. That was very helpful and clarified some of the issues that I'm sure we'll be discussing tonight. I wanted to move on to the public comment section of the agenda, and we have a process for that that I can sort of walk through with you all to try to keep it orderly. And so anybody who wishes to speak should use the raise hand feature on Zoom. So if you look at the bottom of your screen, there's a box that says reactions. And if you click on that, one of the options is to raise your hand. You can click on that and that will key us in that you'd like to speak. If you're on a telephone, if you do *9, that will also cause us to see that you would want to speak and would raise your hand. So that's *9 if you're on a telephone. Because this is a public meeting and for the accuracy of minutes, we'd ask that all the speakers begin by stating their name and their address at the time of public comment. We're limiting comments to 2 minutes, and this is important because we have a lot of people who want to speak, and we want to give everybody that we can the opportunity to do so. We'll give you a 30-second warning at about 1.5 minutes just to sort of make sure you're have a chance to kind of wrap up your comments. But we will mute you after that so that we can include as many people as possible. Of course, we would ask speakers to refrain from disparaging or threatening comments and to stay on the topic. We're going to try to get as many speakers to run through the first time as possible. And before allowing speakers to comment for a second time. We're looking at limiting this segment to 30 minutes. And at the 30-minute mark, we'll kind of reassess things. That would be at 8 o'clock, and see where we are and make a decision about it at that point. I think that, you know, the board members, having heard the public comment, having heard these presentations, would then have a discussion and ultimately make a decision. So Jackie, our administrative assistant, is going to kind of help us coordinate the public comment section. So she will call out the name. We can see the people who have raised their hands, and they will be kept in order. So if you raised your hand first, you'll be called on first, and so forth. And she will call out the name, unmute you, and allow you to state your name, address, and then give your public comment. And then actually I'd ask Jackie to perhaps at a minute and a half, give a 30-second sort of heads up. So Jackie, you want to go ahead and admit the first person? Looks like Paula Wiseman.
Certainly. Paula, go ahead and unmute.
Thank you very much. My name is Paula Wiseman, and I really don't want to give my address because I don't want someone to give me a hard time out in public.
Okay.
And I'm sure you guys understand that because there's a lot of heat going on right now. So I have a couple of questions, and I hope you can answer them about the study that was presented to us about how old were those that got sick? This is for, is it Aid? How do you say your name? I'm sorry. Addie or?
A day.
A day. Excuse me. Thank you. So I guess, you know, how old were those who got sick in your study? Was it just the young kids? So that's one. I have like three questions and then a statement, if you can answer at least that.
So I can give you specific information about the study. I actually did so many studies. So if you want specific information, I can send that to you to your email.
Well, I'm sure other people want to know these questions, and I would hope you'd know that, you know, again, what is the age range of the study?
So which one are you talking about in particular?
Well, about December, you showed these graphs of December of how when the mask, you know, how Reading's numbers went up because you don't have a mask mandate right now. And you had 200 and some
So that was for
get sick.
the general population.
Pardon?
It was for the general population, for everybody.
And so how many people did you study?
30 seconds.
Really? Okay.
Yeah, Paula, I think it would be better to ask the questions. We'll try to incorporate them during the board discussion in your comment.
Okay, let me just make my statement real quick. So since the time's going by very quickly. The science does show that kids ages 5 and even younger up to 18 don't get that sick, for one thing. And science has proved that, you know, all viruses, once you get the virus, you're immune. Okay, so you don't really need a mask if you're immune. And masks are not really needed for young ones at all. I mean, because they just don't get sick. And if the teachers are nervous, they should put a shield on and a mask on and let them be the ones to be the uncomfortable ones. Because, you know, there's so many studies out there that are proving that kids they don't get that sick. And the ones that do get sick are usually ones that have been vaccinated, and it's a myocarditis in young men and various other things that have been happening because of comorbidities. So that's just my couple of things I wanted to throw out there.
Okay, thank you. Thank you, Paula.
Thank you very much.
In the discussion.
Thank you.
Thank you. Jackie, Rebecca?
Next up is Rebecca.
Hi, so I'm a Reading resident, and I have kids who go to school in Reading, 3 of them. One of the things I wanted to say is last year, my youngest at his end of the year ceremony for kindergarten, all the children said their highs and lows of the year. And most of the children, 5-year-old children, said their low was wearing a mask. And I just found that extremely disturbing that we're doing that to these children, making them wear those masks all day, every day at school. And now as they go out and about, they're expected to wear a mask. So I just don't think, and like Paula said, obviously people get sick, but the children are they're not dying from COVID. And I think that, it does affect the oxygen levels. I know that that Aday had mentioned that it doesn't. My youngest again has lung issues, and he was wearing a disposable mask for like 2 minutes and had his oxygen checked at a doctor's office. He put it on before we went to the doctor's office, and his oxygen was low, and the nurse had him take off the mask and take a couple deep breaths, and his oxygen went back up. So for wearing the mask for like 5 minutes, it affected his oxygen. So to say that it doesn't is not true. I would also like the data based on all of his quote unquote facts that he stated, because I'd like to see where he got all those facts. And then the doctor on CNN just recently said cloth masks are basically just a facial decoration. They do nothing. So unless we're forcing people to wear a certain kind of mask, it's basically useless. So I just don't think, and I think, COVID is here. People get sick. This is what we've dealt with since the beginning of time. And I think, instead of just living this life of fear, we're not going to be wearing masks indefinitely. I hope not. Even if you do create a mask mandate, I would like to know what the end date is, because I don't think it would be expected for everyone to wear masks indefinitely. So that's my piece. I don't think it makes a difference. They are uncomfortable, and I don't even think they're safe for especially children to be wearing for long periods of time. Thank you.
Thank you, Rebecca. I could just make one comment just to clarify things for others who might want to have comments about the school system. Is we're really talking about whether to have an indoor mask mandate for public indoor places, like restaurants and businesses and so forth. The whole issue of mask wearing in the schools is something that the state has mandated, and that the Reading School Committee is responsible for following through and making decisions around that. We actually don't have jurisdiction over that component. So I just want to make that clear for future commenters, that we're really not talking about the school situation. We're really talking about the general public. So next, individual, Joseph White. Jackie?
Go ahead, Joseph.
Hi, my name is Joseph White. I live on Prescott Street in Reading. I've been here for 17 years and came here to work at Dana-Farber as a research scientist. I recently contracted COVID even after being fully vaccinated at the time. And I went through quarantine. I've since tested negative and have gotten a booster. But because of the infection, I developed an atrial flutter. We know for sure that the flutter is due to the virus. That caused me to have to get cardioverted at a hospital, meaning I would have to spend time, money, and limited activity to go there and do it. I don't want this virus again. And the reason I probably picked it up was because after being fully vaccinated, I was able to go out in public without a mask, and several times I did. I picked up the virus and suffered the consequences. Recently, a family friend visited our home for during the Christmas holidays. She was wearing a mask. She had recently been to Cancun and spent some time with us, about an hour and a half or more. We found out that a day later, she tested positive for COVID. My daughter and I both had to cancel some events, and make certain that we were negative, but eventually we found out that we were negative, even after close contact with her friend wearing an N95 mask. The mask works. We know this for a fact.
30 seconds.
So what I want to say, basically what I want to say is we have a clear and present danger in the atmosphere. It's a virus. We know how to protect ourselves. We know what to do. That is mask, distance, hand hygiene, and test. The tests are rare, so we're really left with masking. And not to do anything is, I think, we'll wind up suffering the consequences of our inaction. So I think a mask mandate makes a lot of sense. Thank you for listening.
Thank you. Thank you for your comments, Joseph. Jackie?
Ms. Grant.
Hi, you can hear me?
Yes.
This is a great topic. From the beginning of this pandemic, this mask thing has been a double-edged sword. So I'd just like to give you some data. I work in the trades. I have to be OSHA compliant. I listen to Adair's research. And to be quite frankly, I can create graphs like that. And there's nothing behind what you showed us. And the residents of Reading deserve to know your statistics, your data, because I'd like to explain to you OSHA's guidelines. OSHA's guidelines from the 1960s and the 1970s and onwards. OSHA determined that a virus, no mask can protect any person from any virus, whether it's a flu virus, any type of virus that exists. No mask can protect anyone from a virus. Why? Because a virus will go right through a mask, even an N95. And so what OSHA did was they created standards. And so what they said was doctors had to wear hazmat suits in a serious situation. If a virus was in the room, they had to wear hazmat suits with gas masks. The mask was the purpose of a mask is for aerosols. Now, what Adair has just told us is when someone coughs, that's why we wear a mask. Now, this is kind of ridiculous. You want me to wear a mask just in case I cough once a day? See, this data is it's just created. It's just assumption. Then Joseph just said now he's vaccinated. Obviously, the vaccine doesn't work. I feel sorry for you, Joseph. We're going through all that, and the vaccine didn't work. And then you had someone come to you and wear a mask, and because you didn't get COVID, now the mask works. You can't use that logic. That's not even science. You can't. That's not even logic. Okay. So what I'm trying to say is this mask thing is, let's just connect the dots. Fauci has said this. He said, oh, you need to wear a mask because of aerosols. Now, let's just think about this. Let's connect the dots here. Aerosols. A virus comes from your breath. We breathe 24 hours a day. Aerosols comes from someone speaking, coughing, or sneezing randomly during the day. So you want to mask for someone coughing, sneezing maybe once a day versus someone breathing the virus 24 hours a day. So, and what that means is when someone's breathing the virus, it's going straight through the cloth, straight through the N95. In fact, it's going around his nose, and it's getting into him. So if someone has COVID, someone will get it because it's going to go through the mask, and someone else who's wearing a mask will go around his nose. So this mask thing has this, there hasn't been enough thought with this thing. It doesn't make sense. So you're masking children, you're masking public. When people, if someone has COVID, whether it's Joseph with his weak vaccine or someone else, if someone has COVID, I just hate to break this to you, you will get it. the virus will go through the mask because of the virus, the COVID virus is 50 billion times smaller than a mask. It's like trying to have a chain link fence to stop mosquitoes. This is how ridiculous this mask mandate is. And I cannot believe that these are doctors and scientists who are enforcing the public with this data. And so what I would like to say is you need to go to OSHA and ask them, why did they pass these laws where doctors had to wear hazmat suits for viruses, but only masks in case they sneeze in an operation? Okay? So this masking thing does not make sense. And if you're telling me I'm going to repeat myself. Yes, it will protect you from an aerosol 20% of the time, maybe 5% of the time. Okay? But what about the 99% of the time when that person's breathing and it's going straight through his mask? Because the virus is active through breath. So I don't know how you guys want to deal with this, but none of this makes sense. Thank you.
Thank you, Grant, for your comments. Jackie?
Okay, next is Vlad and Becky Lieberman.
Hi, my name is Rebecca Lieberman. I live at 50 Pratt Street in Reading. As an epidemiologist, I strongly urge you to adopt an indoor mask mandate in Reading to protect residents and visitors and to avoid adding to the burden of our overwhelmed healthcare workers. Masks have been shown to significantly reduce community spread of COVID-19, and seniors, immunocompromised individuals, and those with other medical conditions are at particular risk of severe disease if infected. COVID-19 infection is especially dangerous for pregnant people, having been linked to preterm birth and stillbirth. Full disclosure, this is what I study, and it's also been linked to severe maternal disease and death. With school resuming after many having gathered for the holidays and pediatric hospitalizations for COVID-19 skyrocketing, we really need to reduce community spread in order to keep families safe and to continue with in-person learning. No one liked having school remote. In addition, I urge you to require all town employees to get vaccinated and to require COVID vaccination in schools. You also need to please hold more vaccination clinics because we know that vaccinations combined with booster shots give very good protection against severe disease and that these prevent hospitalizations and death. Wearing masks, it's a small inconvenience, but it saves lives. Please implement a mask mandate. Thank you.
Thank you, Rebecca.
Next up is Sarah M.
Hi, good evening, and thank you, everybody. Sarah McLaughlin, South Street. I have a Master of Public Health degree and former Department of Public Health employee in the Bureau of Chronic Disease Prevention. In full disclosure, I'm also a current school committee member. I'm here tonight to express my thoughts as a public health professional, longtime Reading resident, community member, and mother of middle school age children. I'm not here to represent the school committee or their point of view. As many have noted already, we're in the midst of a massive COVID resurgence. The daily case average is at its highest in nearly a year, and hospital admissions have more than doubled across almost every age group, including young children, young school-age children. However, we know more than we did even last winter. We know how COVID is transmitted. We know how to prevent surges in case numbers. We know that strict mitigation measures are critical for slowing the spread of COVID and thus overtaxing an already burdened healthcare infrastructure. Beyond even the healthcare and hospital infrastructure, my biggest concern by far is the huge toll we're placing on our school staff and students, a population that has largely shouldered a significant brunt of the pandemic burden and continue to bear that burden as we weather additional surges in community transmission. Like many districts in the state, we already have substitute teacher resource constraints. We've seen increased number of staff absences due to COVID and are increasingly unable to fill the majority of those with substitutes. From past pandemic experience, we know that remote instruction is a poor substitute for in-person learning. It's largely ineffective for the majority of our learners and places an enormous toll on students and their families. In addition, remote instruction is not allowed this year per the Department of Elementary and Secondary Education, and it does not count toward required instruction time. The data are clear. both from science and research published in peer-reviewed journals and real-world evidence from our neighboring communities. Indoor mask mandates are hugely effective in lowering community transmission rates when used along with other mitigation strategies. It is our collective responsibility as a community to deploy all our available tools, including reinstating an indoor mask mandate, in order to flatten the curve of the current resurgence and lessen the impact on our most vulnerable populations, including our students and educators. So thank you for your time and consideration in putting in place a mask mandate. Thank you.
Thank you, Sarah, for your comments.
Next is Narcissa.
Hello? Okay, sorry about that. I was trying to unmute myself. I'm Narcissa. I live in Reading. And I was here at last week's meeting. Ade was kind enough to send me the chart with various towns, and I did my own sifting of the information provided. I don't know if I'm allowed to display here or not, but I looked at like 15 towns, and then I added population to it, as well as what the caseload was for just a daily case, as well as over the 14 days from the information provided. And a lot of the comparison, I compared, obviously, enforced mandate, which is what we're considering, or what you're considering anyway, over a recommendation, as well as some towns that don't even have a policy at the moment. The differences, to me, are definitely not clear that mandating works well over recommending it. For instance, I think Ade used Winchester and Reading. So the percentage difference is less than a tenth of 1% difference between how much, because Winchester came out with, for the 14 days, 0.0237%, whereas Reading came up with 0.0301. So that's less than a tenth of a percent. Then if you even go to some towns, for instance, Framingham of all places, had an even lower case, and they only require public masks in municipal buildings. So there's nothing obvious that makes this the answer as far as recommending versus mandating. What I would also like to say is that no mandate is supposed to be going against either the Massachusetts Constitution or the federal Constitution, and a mask mandate certainly does by limiting free speech.
Okay, I think that's 2 minutes. Thank you, Narcissa, for your comments. Barbara Caulfield.
Hi. Yes, hello. Thank you for having me. I did want to say, some people have shown and talked about studies and also talked about data. Studies, for every study that says this, I can find another study that says that. So you have to be careful when you look at results of studies, and also know that data can be manipulated in a way to try to convince someone one way or another. What I do want to say, and I also want to say, I apologize. I don't apologize, but I'm sorry for what Mr. Joseph White has gone through, what happened to you. And it's a shame, and you probably should wear a mask going out in public, not necessarily for COVID, but for any upper respiratory virus or something that could cause you to become seriously ill. But that's not my situation. And me not wearing a mask, if you do, does not make you that much more susceptible to getting sick. People who are healthy should not have to wear masks when they go out in public. There's data that also shows that the transmission from people who are not sick, of course they can't transmit it, or even asymptomatic, is very low. We have to think about our children also, because the psychological effects of them having to wear a mask every day outweigh the risks. And data shows this, that children are not susceptible to COVID. So they're also, thank you, they also don't transmit it. Studies have shown that as well. So I want to thank you. We have to also look at personal liberties versus the health. And this COVID for most people is no different than any other upper respiratory virus, despite what the news and the media want you to know. We should stop looking at cases versus really sick people. How many people are getting really sick from this? Despite what they're saying about hospitalizations, yes, people may be hospitalized with COVID, but it doesn't mean it's because of COVID. Lots of things to think about. Thank you.
Thank you, Barbara, for your comments.
Rick, if I might just step in,
Yes.
for all those that want to address the board, that's fine, or yourself, but we should not, keep it to not addressing other members of the public that are commenting, just as a standard course.
Good point.
Thank you, Kevin.
Next is Nancy D.
Hi, Nancy Doctor, 371 Pearl Street. Feel free to reach out. I am in the phone book. I'm a clinical nurse specialist, and I'm not going to repeat any of the scientific medical data that was shared earlier in support of a mask mandate for the town. I actually was very disappointed that you did not, as a board, enact a town-wide mandate when you voted last week to enact one for the senior center. So I have complete confidence that you will correct that today and you will vote for a town-wide mask mandate. My public comment is also to reiterate what another speaker had asked, which is to focus on promoting more vaccines, clarifying the change in the booster statuses, and to actually remind people the correct way to wear a mask and the need for N95s, particularly around any of our most vulnerable citizens, immunosuppressed, fragile residents. I know that you had mentioned earlier about not having any control over what the schools do. So I am asking the board to perhaps make some recommendations that the schools consider immediately limiting the number of individuals at their youth sporting events, because we need to do much more than just the town-wide mask mandate. We're behind on this, and I don't want us to fall behind any more on some of the things that are really, really, really critical. So I thank you very much. I thank you very much for having this vote tonight.
Thank you, Nancy.
Elle Dorning.
Hi, thank you. My name is Lynn Dornick. I live on Cherry Lane Drive, and I believe strongly in a mask mandate. My husband has had a heart transplant, and I know we've had scientific data and counter data. I'm just going to invoke the golden rule: do unto others as you would have them do unto you. This isn't about one person, it's about all of us. Thank you.
This is Caitlin.
Caitlin. Go ahead, Caitlin.
Hi, thank you for letting me speak. My name is Caitlin, and like somebody else said, I don't want to give my address for fear of public backlash. But I guess my point is to what the health experts said a day, with wearing masks in public, people who are COVID positive can spread it. It seems to me like instead of trying to tell people what should be mandated to protect other people, why aren't we encouraging people that are sick to stay home? And then furthermore, since, the ridiculousness of you're going to not be safe unless we're both wearing a mask, there are no studies that actually scientifically prove that. And I personally feel like mandating something goes against the golden rules because, as somebody said, our personal liberties should come first. And when you mandate something, it's taking away a person's personal liberties and freedoms and choices. And I don't understand what gives people the authority to tell me what's best for my individual health or anybody's individual health. You know, we have people that are triple vaccinated getting this virus, and, you know, unless you're OSHA certified or wearing the mask as OSHA, like, unless it's airtight to your face, it's not doing anything. So, you know, there's a lot more to think of than just a few studies or a few experts. You know, some of the best experts are the people like me that don't have degrees in research, but are doing a lot of research. And for one of the most vaccinated states, and if you go into any store in Massachusetts, even as a choice, people are more masked up than any other state, and we have the highest COVID numbers. So a mandate is only stands to remind those who want the mandate, you know, by you mandating me to mask up is only for those who like the mask's benefits. Otherwise, my blank face reminds them of their cowardice and fear. Thanks.
Thank you for your comments. I just want to point out that we are at the 30-minute mark of public comment. And I think, you know, we want to include as many people as possible. If I look at the list of people who have their hands up for first comments, I count about 6, 8, 10, 11. So 11. So I think we're going to extend the public comment another 30 minutes. We won't take any new requests for comments beyond, I believe, Justin Perry. We will limit it to first comments only. And that should bring us to 8:30, at which point we'll conclude the public comment section. So I'm going to ask, I guess it's Vicki Fortin.
Hi, Vicki.
Hi, Vicki Fortin, Pleasant Street. Can you hear me?
Yes.
Okay. I'm not going to beat the dead horse of whether or not it works. Everybody else is going to do that. But I strongly really request that you think about the fact that much as the majority of the population is not majorly affected by wearing masks, there are some of us who are. And to say that I can't go to the grocery store unless I put my health at risk is a problem for me. I've lived, you know, we live in a free country, and right now there's places I am not allowed to go. And that's just wrong to me. And I'm just going to leave it at that. Thank you very much for hearing.
I need the light. Next is Lori, sorry.
Hi, Laura.
Hi. Hi, guys. My name's Lori Haverty. I live in Reading, but I'm also a small business owner. And I'm not going to go into much of it, except please think of your small businesses, especially one like mine, where people sign up and make the choice to enter. We're not open to the public unless you are part of the membership. I own 3 facilities, 1 actually in Winchester and 2 in Reading, and 3 gyms. And people don't just walk in. They walk in masked and stay masked if they choose to. And then they walk in unmasked if they choose to. We do ask everybody if they're not vaccinated and they decide to enter and come in and get their workout in and feel the healthiest they can to stay masked, and they do. So on our end, I know that we're doing our best to keep everyone in the town healthy, as well as stay afloat after being closed for almost 16 months. So when you make this decision, I would love for you to think of what the small businesses need and what they're doing for your community as well. Thank you.
Thank you.
Next is Laurel.
Hi there. First and foremost, I would like to thank you for allowing the public to comment on this meeting. Some other towns have ignorantly decided to avoid the input of their constituents, which I think we can all agree is wrong. as public servants. I want to address the fact that experts have now confirmed that this is endemic and is not going anywhere. Experts have confirmed that we will all come into contact with this virus, whether it's today, tomorrow, next year, 2 years, 3 years, 4 years. We constantly come into contact with thousands of viruses every single day of our life. So to you, I ask, at what point will we stop? If we did this for the flu, cold, etc., it will never stop. And it seems that this is where we are headed. Your point, Ade, about face masks not affecting children is deceitful. The study is happening now in real time, and from what I see in the schools, the children are struggling. Per a study on edsource.com, the pandemic is leaving its imprint on all of us, but experts suggest that it is most keenly affecting babies and toddlers. A new study by researchers at 5 universities found that babies born during the pandemic have lower IQ scores than those born before it. Babies who came into the world before coronavirus had a cognitive score hovering around 100, according to the study. But the test scores of babies born during the pandemic fell sharply to around 78. That's 22 points lower than what's normal. And that's a direct quote from the study. At this point, we have a majority of the population vaccinated, and masks have been implemented periodically throughout the past year as well. 2 years, Cases in Massachusetts are higher now than they ever have been. Why do we keep implementing and mandating things that do not work? Why don't we focus on things that actually work, such as air filtration, general sanitation, and prioritizing at-risk individuals? They can wear N95s, they can do what they need to do. The definition of insanity is doing the same thing and expecting different results. Mandate after mandate, we fear will turn into vaccine mandates. Nothing is to be mandated upon those in a free society. Thank you.
Thank you, Laurel, for your comments.
Next is Rachel's iPhone.
Rachel, press *6 to unmute.
I've asked her to unmute, but
Okay. Why don't
we can move Jen,
yeah, why don't we move to
if you'd like,
Jen?
and go back to Rachel.
Yes, let's do that.
Sounds good. Okay. Jen, go ahead and unmute.
Good evening. Thank you. I also do not wish to provide my address. I just need to start by saying that the PowerPoint shown before the board was the most unscientific presentation I probably ever witnessed. Never have I seen someone who wanted to be taken seriously present information without any citations to support the graphs or conclusions they had reached. There are no randomized control studies or mixed correlational evidence to show that masks are beneficial. We know masks themselves are ineffective and can spread disease because it had been demonstrated by the largest study of the use of medical and cloth masks back in 2015 by researchers in Vietnam. This trial comparing 2-layered cotton cloth masks to medical masks showed a 13 times higher risk of infection in the cloth masks and concluded penetration of cloth masks by particles was almost 97% and medical masks by 44%. This study suggests cloth masks are not only ineffective, but they may increase the risk of infection, including viral infections such as COVID-19. In April 2020, an article was published in the New England Journal of Medicine, which concluded, and I quote, "We know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. In many cases, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic. It is also clear that masks serve symbolic roles. Masks are not only tools, they are also talismans that may help increase healthcare workers' perceived sense of safety, well-being, and trust in their hospitals. Although such reactions may not be strictly logical, we are all subject to fear and anxiety, especially during times of crisis. One might argue that fear and anxiety are better countered with data and education than with a marginally beneficial mask, particularly in light of the worldwide mask shortage, but it is difficult to get clinicians to hear this message in the heat of the current crisis. A September 2020 report by the CDC found that more than 70% of COVID-19 positive patients contracted the virus despite faithful mask wearing while in public. 14% of the patients said they often wore their masks who were infected. Meanwhile, just 4% of the COVID-19 positive patients said they never wore masks in the 14 days before the onset of their illness. Additionally, one just needs to review Cal OSHA's October 2020 document titled Safety and Health Guidance, as it states cloth face covers are not protective equipment and do not protect the person wearing a cloth face cover from COVID-19. Regarding a day's ridiculous claim that it is safe to exercise with a mask on, please read the study by Baylor Scott and White Hospital in Dallas that found wearing face masks while exercising reduces oxygen and increases heart rate, resulting in reduced exercise capacity by 29%. There are now numerous doctors going on the nightly news shows who are reversing their previous positions. I have 10 more seconds, please. And finally acknowledging that cloth masks do nothing to stop COVID. While a mask mandate might make people feel better, it is completely illogical. And please never let anyone take away your freedom because of the greater good. Freedom is the greater good. Thank you.
Thank you for your comments, Jen.
So it looks like Rachel's iPhone reconnected. Do you want me to go with her
Yes,
since she's actually
sure.
next? Okay. So Rachel's iPhone, if you can go to mute.
Hi, thank you so much. Sorry about that earlier. I appreciate you letting me have a chance to speak again. Although I appreciate that the goal is to be concise and clear with one's thoughts in that initial slideshow, I'd like to echo what was just stated, and I pray that this Board of Health will do a much deeper dive into those facts and unpack that data. The laboratory studies out of the JAMA that state that masks, quote unquote, work involve particles being shot at a mask on a dummy and not in real world usage. Those disposable and surgical masks that function in a surgical and sterile setting are not made for real world settings, and they're certainly not made for citizens traveling through local stores, touching them numerous times, dropping them on their car floorboards. Not to mention that on the box itself of those disposable masks, it states that these types of disposable masks do not stop viruses like COVID-19. Also, referencing that there are studies that demonstrate a lack of negative impact on children is laughable. There are no studies on the long-term effects of this, and to pretend that we have the data on this pre-2020 is disingenuous at best. I want to echo the previous constituents who spoke to that. As was mentioned earlier, please remember that for every anecdote that masking works, quote unquote, there is one that demonstrates that it doesn't. Of course, we know that there is danger for a subset of the population when it comes to severe disease. It's foolish to ignore that, but it would be foolish to ignore that those subsets of the population should be protected. They should wear N95s, face shields, they should limit their contact with the public, and of course, they should have a serious conversation with their own physicians on their own time. It is now on those populations to assess their own risk. To ignore the 22 months of data that we have, to double down on policies that have not been working. If masks worked, they would be working. Massachusetts wouldn't be entering its fourth wave as we have an extremely high mask and vax compliance rate here. The outcome looks the same. The viral curves look the same, no matter whether there is a mask mandate in place or not. And to ignore all of that, the 22 months of data that we have is just plain foolish. Thank you very much.
Thank you for your comments, Rebecca. Or Rachel, sorry. I'm gonna go back up to Madeline.
Go ahead, Madeline.
Madeline, you're on.
Looks like she's unmuted.
Yeah.
You just muted again. Let me try and unmute her again. Madeline, you can go ahead and unmute.
Hi, sorry. Can people hear me?
Yes.
Okay, had some issues with the audio. I'm a Reading resident on Pratt Street, and I am strongly in support of the mask mandate. I want to echo what was said earlier, that this is about all of us and not just individuals, because really we need to be protecting the people who are most vulnerable here. It was mentioned that pregnant people, we know that there can be negative effects on pregnant women. Elderly individuals, immunocompromised individuals, we're wearing masks to keep them safe. And personally, I am willing to give up, to take on a small amount of discomfort to keep those populations safe. Masks are not shown to limit oxygen flow. Healthcare workers have been wearing them for long periods of time during surgeries in hospitals, long before the COVID-19 pandemic, and not having widespread negative effects. And furthermore, some of these studies that people have been referencing are talking about masks in general, and we should really at this point be differentiating between the different kinds of masks, because cloth masks are shown to be less effective at this point. But if we have people wearing well-fitting KN95 masks, N95 masks, surgical masks, well-fitting masks are shown to be up to 95% effective at reducing the transmission of COVID-19. So if we increase the education on mask wearing, get people wearing well-fitting masks, I think that is definitely, it's shown by the most recent studies to be effective in reducing the transmission. And also, I recently went into a business in Reading where masks were supposedly recommended for those who are, and I was interacting.
Madeline, we're losing you.
With,
we're losing your audio. And actually, we're almost over 2 minutes.
An employee who told me she wasn't vaccinated while she was. That was, all right. Thank you very much.
Thank you, Madeline. Eva?
Ava.
Hey everyone, can you hear me?
Yes.
Thanks. I would like to thank everyone for these great comments, and I would like also to add my feedback as well for the community. So I want to say that me and family, we are all against the study. The study that was showed at the beginning of the meeting with the screenshot doesn't look like it has a lot of details, and I believe it's not accurate. So hopefully we can get more details and more explanation about the study that was showed during the beginning of the meeting. So a lot of studies from different countries, they show that the masks are not really healthy and they don't protect as we pretend. From a lot of studies, like hundreds, I would like to say that we have kids as well. They go to school, and every day they come back to home. They complain about these masks. Sometimes they have their ears hurting, breathe issues. They can't breathe, and it's really bad for the kids, especially for the kids. And every time we complain to these mandates, for us means it's less freedom. And we are 100% sure that some leaders will take advantage of these mask mandates and change the path to a vaccine mandates after that. And thank you.
Thank you. Thank you for your comments.
Next is Julie Ilias.
Hello, can you hear me?
Yes. Yes, Julie, go ahead.
Looks like she muted herself.
Yep.
And unmute her again.
Hi, sorry about that. So I just wanted to say that it's honestly becoming embarrassing to be an American at this point with the mass formation psychosis everyone's under. I'm listening to all these people wanting to tread on our freedoms due to their media and politically driven fear and anxiety. Shame on all of you. You have no right telling me to wear a mask. I have health conditions that prohibit me from wearing a mask. I have natural immunity from COVID. No one seems to take that into consideration, though. This is supposed to be the birthplace of freedom. Now they want to do vaccine passports. It makes me sick. When you bait and switch mask for vax, it's evident. All this like evidence with all these CNN parrots we're hearing, disgusting. Bringing America into communism and Massachusetts, really? This is ridiculous. That's all I have to say. This is absolutely disgusting.
Thank you, Julie, for your comments. We're going to go to Justin Perry because we're limiting the public comment to first commenters. I don't want to open up to second because then, in fairness sake, we could open it up to additional people who already spoke. And so we really need to limit it to first comment. So I guess we would go to Justin Perry.
Hi, folks. How are you? Justin Perry, Whittier Road. Thank you for giving me this opportunity. I hopped on here because in watching some previous Board of Health meetings, it's evident that you folks genuinely care about the community and you're in an extraordinarily difficult situation. I want to be clear, though. I think that we're in a different place now than we were in October. And to be honest, Mr. Lopez, you're a physician, correct?
Yes, I am.
So you more than anybody can probably appreciate the moral and ethical dilemma that you're presented with the do no harm oath that's center to everything. As a physician, you don't have the privilege of being able to take something in a vacuum. You have to consider all positive and negative effects. And that's why I think it's appropriate that you lead this board. I think where we find ourselves is pretty clear. The vaccines don't work in the way that they were originally sold to the community as. There's genuine questions in how these vaccines are engineered and whether or not the immunity, the narrow immunity that the current ones provide will be eventually good enough to do what it is that they're saying that they're doing without 16 different boosters. And what we've seen across the board, from changing the definition of anti-vaxxer, changing the definition of vaccine, changing the definition of vaccinated. Vaccinated used to mean
30 seconds.
Thank you very much. We're at the point where the entire town, whether or not they have taken the vaccine, they are sensitive to the fact that this is a much bigger issue, and it's not a mask issue. So I think that the only way that the masks go away is is people get vaccinated, and the people that have gotten vaccinated will maybe continue. The people that haven't won't. So this is never going to end, folks. And I think it's important to be able to acknowledge that. Thank you for my time.
Thank you, Justin. All right. So that actually concludes the public comment part of our agenda. We've heard a lot on both sides of the issues and a lot of different perspectives. And I think it's now up to the board members to perhaps, comment on their perspectives and integrating what they've heard. And, we've had these discussions over the last couple months. And, I'm not sure I should necessarily go first, but I have a lot of thoughts as well from what I've heard. So I kind of open it up to, comments, please. Schwang, yes.
Thank you, Dr. Lopez, and thank you for all the public comments. I greatly appreciate that. And my name is Shuang Shen. I'm the public health nurse. I would like to share some thoughts for the board and the public. So, you know, in general, wearing masks is helpful. And as you may watch the news, on December the 29th, WCVB News has reported that every time the government ring the bell of fear, like, you know, COVID, a small business closes a store. You know, so any mandate may affect the small business in Reading. So, so I'm wondering, you know, if we, the public, the Board of Health, and the Health Department could work together and, you know, have a balanced approach to any of these mandates. And in addition, for many surrounding towns like OBrien, Wilmington, North Reading, Linfield, etc., all of them do not have an indoor mask mandate. Some of them have masking mandate for municipality buildings, but not for indoor public places. For example, Wilmington required masking in all town-owned buildings, and North Reading required facial coverings when entering the town buildings. You know, similar to Wilmington and the North Reading, I'm wondering if we shall think about the mask mandate for municipality buildings to keep the government employee safe and healthy and allow us to provide the highest quality of service for our public. In addition, I would like to, you know, let all of you know, just today we have ordered 200 doses of COVID vaccine and 400 boxes of rapid test kits. Hopefully, we shall receive the vaccine by the end of next week and have the clinic for our first responders. Moving forward in the future, we are thinking about opening vaccine clinics at least once a week. And for the testing kits, as soon as we receive them, we will distribute to the public as soon as possible. Thank you very much.
Thank you, Schwang. Okay, so I guess maybe I will jump in and give some thoughts. So first of all, I just wanted to make a comment on a couple things. One is the whole notion of natural immunity, and if I've had COVID, you know, then I'm not, I can't get infected again. In fact, you can get infected again. You know, there are different variants than the original COVID, and even natural immunity wanes, which is why even for vaccines, one needs to get a booster because the immunity wanes. So this whole thing about natural immunity, it is something, but it's not foolproof. I think, you know, secondly, it is true that children, by and large, get very minor illnesses related to COVID. However, there are, if you talk to anybody at any of the children's hospitals across the country, they are seeing more children being admitted, and it has to do with numbers. You know, if one in 1,000 children, you know, need to be hospitalized, but you have 1 million children who are exposed, there are large numbers of children who get very ill and die. So it is true they have more minor illness. It's not true that they're protected against severe illness and or death. I also want to point out that typically the annual influenza that we see every year, that we get our flu shots and we've been inculcated in, typically kills about 50 to 60,000 people a year. In the past 2 years, over 800,000 Americans have died from COVID. There is a big difference between 50, 60,000 a year and on average 400,000 a year. So it is still something, the virus is a formidable enemy. So in terms of my personal feelings about this, I think, I have been actually perhaps a little bit more conservative over the last 2 or 3 months because our case rates were relatively low, even as in September, October, even as the surge was revving up. And I think we have been moderate around that. And so some people will say we were doing the right thing, and other people will say we were much too conservative and dragging our feet. But I definitely don't think we were, our actions to date have been something that has been capricious in any way, shape, or form. I think what's changed for me is that with the Omicron variant since Thanksgiving, things have escalated, and hospitals are reaching capacity, and I think it's a very different situation today than it was 30, 40 days ago. I think that mask wearing is one thing that has been shown to help mitigate the spread of the virus. It's not absolute by any chance, by any, any thoughts about it. It's definitely not absolute, but it's one of a series of things like social distancing and plexiglass and better ventilation and all these other things that contribute to helping stunt the COVID activity in the community, which in turn reduces hospitalizations, which in turn reduces deaths. So I think that it's reasonable to consider it as an important mitigating factor. I also think that the whole concept of it's a slippery slope. If we do this, then next thing you know, we'll be doing vaccine mandates, and next thing you know, we'll be locking people down and clearing this. I mean, that is, that is not reality, and that is not true. One can make a decision about one intervention, and in the absence of other mitigating factors, not necessarily go down that path. We have not talked in this board about vaccine mandates or lockdowns or anything else, because we do have tools like vaccinations that create a very different situation than March of 2020. So, I think I want to say one other thing, because there was a comment about changing the fact that we were sold vaccines as they were going to prevent illness, and now they don't prevent illness and people get breakthrough. Well, the thing about science is that it changes. We make hypotheses, we do studies, we understand conclusions, we continue to study a problem, and new data arises and we reach new conclusions. So I agree that I don't think at the dawn of the vaccines, when they came on the horizon, that people were thinking about breakthrough, but in fact it happens. But what we do know is the vaccines do prevent serious or reduce the risk of serious illness requiring hospitalization, and reduce the risks death. So they're still very, very, very valuable. So anyway, that's my soliloquy here. I feel like whereas we were prudent earlier in the fall, I think the situation has changed. I personally think we ought to have a mandate for use of masks in public indoor places, and that we don't have it open-ended, but we review it at every meeting to see where the data is and whether it's reasonable to discontinue it. And in that, I think at this point, if you look at the communities that have this, they do in general have lower rates. It doesn't solve the problem. If it solved the problem, we wouldn't even be having a discussion. But it does seem to have some impact. And that's what, as a board, what we're here for is to promote the public health. And we have to take all the information that we heard today, incorporated with all the data that we've seen on whether it's the mass.gov site or other locations, and reach a conclusion. So that would be my conclusion, to implement an indoor public mask mandate, to review it at each of our monthly meetings, which are the first Thursday of each month, and to discontinue it at the point where it's clear that the activity has not reached zero, because it won't reach zero, because we know it's going to be endemic, but it's reached a level of activity that it would seem safe not to have that. And so that's kind of where I am. I'd be open to comments by other board members. Paula?
I had written down in my notes many of the same comments that you had made, Rick, and I wanted to address a couple of other thoughts. You said something about the immunity is not permanent. Well, that's been tested out with the pertussis vaccine is another one that the immunity wanes after time. So that's just another example of that. The other piece that I wanted to add to that is for some people, and there's no predicting who, to my knowledge anyway, that the immunity just doesn't kick in, or at least not as effectively as it does for most. And, that's just something, I don't know of any studies that have been done about that, but it does remain a fact. The idea of the air filtration systems, one gentleman had mentioned about how he had that in his facility, and that mitigates the need for masks. Well, we've had the MP13s at the schools, yet we still have had cases, and that's with masks. So just doesn't go across the board that air filtration will mitigate the need for masks. The other concern, as much as I hate to say it, the kids aren't getting that sick, but they are spreading. So, and the vulnerable can be getting it from these children. I would hope that people would think about that when they bring their kids to the grandparents or their great grandparents or someone who's ill, but it is a concern. So I think that we have to be prudent about this and follow the guidance that science has provided us. And I would be in favor of a mask mandate as well.
Carrie, any thoughts?
I was going to say, Kerry, you want to go? You want me to go?
We'll let Kevin start.
Well, I figured the voting members would want to speak first, but either or, doesn't matter to me.
Go ahead.
Okay. All right. So I've had a hard time, honestly, with this one to advise you all on what to do here. I did have some questions that I was hoping to get some answers to. I'm assuming Christine is a little too swamped with contact tracing So I didn't see her on the call.
No.
Maybe Schwing might have some answers then. So when you put a mandate in place, even a small one that's across the town, you know, the board really needs to ask themselves a critical question. If I pull this lever, what will it do? What effects will it have? In other words, do I get a great effect from it, a large effect from it, or just a small effect from it? That's really a kind of an important question you all have to ask yourselves when anytime you put something like this in place. I was on the board in March of 2020 when we did put it in place at the time, obviously with absolutely zero information in our hands to do so. You know, we felt the alert, raising the alert flag that high was absolutely the right call at the time for many reasons. You know, I think moving forward now, where we are, coming up almost 2 years later, you know, we do have a lot more information and we have a lot more data, again, which we didn't have at the time. So a couple of questions that I had around that was, one, where are people actually transmitting this? Are we transmitting it at the grocery stores, at the restaurants? Are we doing it in a large enough amount that if we prevent that cause, and we won't prevent all of them, but we could prevent some of them, is that going to move the needle enough to warrant a mandate? So that would be the one question I would have. I think we've all heard about the severity of illnesses, but I'd be curious about our own 281 that we have here in town. How sick are they? You know, is it broken down? Do we have that information somewhere? Sorry, Schwang, putting you on the spot here.
No worries. Thank you, Kevin. Yeah, I would say for the transmission, we sometimes receive, phone calls regarding household transmission. We have, parents calling saying their family members and kids have COVID. We also receive phone calls from like school sports team, if, to positive cases, then it's a cluster. So we have those kind of transmission. And we also receive calls like just for individual, like they have positive case themselves and wondering like what they should do. And I'm not sure, Ade, if you have any thoughts on that.
I would mention that the number of deaths in the community from COVID has been flat, I think, since the spring. There haven't been any deaths since the 50 that Christina's reported. And in the past, she has reported if there had been any hospitalizations, and I don't know whether she hasn't reported it, but because she's not thinking about it or not tracking it, but I haven't seen any comments around hospitalizations recently. On the other hand, I've seen data and most recently around local hospitals, Leahy, Winchester, Melrose, Wakefield, that show pretty high numbers of COVID cases. They're not maxing out,
right,
but their ICUs are very high, and so that's our region, and those are the hospitals that we use. So that it is impacting the hospitals. Jerry, yes.
Yeah, I can definitely corroborate that. So I do work at a hospital, and just today we got an email that they're putting in place the incident command for COVID again, because the numbers have just been so high. I mean, obviously, I don't think anyone's a Reading resident. I wouldn't know that anyway, but it's pretty, I just feel like what you said is absolutely true.
Okay. So, I mean, that's really my only concern when you're doing something like this is how far are you going to move the needle with doing it? And that's something the board really needs to take into consideration. It doesn't sound like we have that information here tonight, certainly.
I just sent you the information. I sent each board member the information that Christine sent me. Did you guys get it? I sent it to each and every one of you, so.
I have it, Ade.
Okay. So approximately 68% of the present active cases in Reading over the past week are due to household transmission.
Okay. That's what I was afraid of. This is a tough call for you folks. It really is.
Think about, go ahead.
I was just going
The
to
thing
say,
about household transmission, I should just comment, is that intuitively that makes sense in that if you pick up the virus in school or out in the community at, you know, a store or whatever business, you know, and you come, once you're in your household, the contagiousness, particularly of Omicron, but even Delta, is such that it is there's going to be a high rate of cases in that household. But the question to ask is, where did it come from? It didn't come from the household. If the household was locked down, no one would get it, right? So it comes out from the community. So then it leads you to the question, okay, what do you do in the schools and in the community to try to prevent transmission? And so it's a little slippery there.
Yeah, no, I understand. Yeah.
Sorry, Kevin.
Go ahead, Kevin.
So that's again, that's my biggest concern is knowing where is it coming from. And if it is coming from out in public, then obviously a mandate would certainly help. If it's not coming from out in the general public by large masses, then you may not be moving that needle too much. Just my 2 cents. Just playing devil's advocate.
I was just going to add that we're coming off the holidays too, and historically, a couple of weeks after the holidays, we see a big spike.
I certainly would not. I certainly think that a mandate would need to be regularly reviewed and not an open-ended kind of whenever, let's forget about it type thing. We've done it. It would need to be reviewed on a regular basis. Everything we're seeing now is that we can expect many more cases over the next 2 to 4 weeks, and I'm not sure what's going to happen after that. You know, I don't know in February and March whether it's really going to come down like it did in South Africa or whether it's going to linger. We just don't know. But any mandate would need to be with a very short leash around continuing. Carrie?
Yeah, thanks, Rick. It's been a very interesting evening. I am appreciative of all of the people who have joined us. I'm appreciative of all of the comments and the consideration that folks are giving to this. From my viewpoint and from the research that I have done, what we know is that currently the versions of the virus that are out there are highly infectious, that they are most infectious in the pre-symptomatic phase. So the day or two that you are infected, but aren't aware, don't have any symptoms, don't know that you're not feeling great. And so maybe you're out and about doing your business and have no idea that you are exposing others. I also consider the fact that there, as I said on our meeting on Thursday, there are limited availability of treatments. There's only one of the 3 monoclonal antibody treatments available that works with the Omicron variant, which is what seems to be dominant currently. There are antivirals in development, but those are not available yet. It's in short supply. Further, we have short supply of testing, so we have a lot of people who don't have the ability to know, either because short supply of home tests or because of lines. There are lines, lots of people not feeling well, and there are lines at every testing center that I'm aware of. There are testing centers having to shut down their operations because they've run out of tests. All of the hospitals that I work with are fully anticipating that this is going to continue. I'm aware of a couple of different systems who, as was mentioned, are moving into their hospital incident command system. I know that currently the hospitals are deeply maxed out. It's a concerning circumstance, and in part it's because there are healthcare workers who are infected with COVID, but it's also because there are a lot of really sick people, sick with COVID and also sick with other illnesses. So those are the kinds of things that I have taken into consideration. I'll say too, to the discussion we were just having about where are the cases coming from in our community. And I think that actually a mask mandate is a huge opportunity to cut down on that household transmission. If we can stop somehow people from picking up the virus when they are out and about and bringing it home, then you're reducing, so there are 3 people in my house, and if somebody went out and picked it up and brought it home, there would likely be 3 cases. If they don't bring it home, then that's 3 less cases in the math. So that's how I see the impact on that transmission. So I am in favor of a mask mandate for all indoor public spaces with a exemption for those with medical issues, the medical exemption that's allowed. I think we ought to deliver a sign to the businesses, as we did with our Strongly Encouraged. I think we ought to provide a sign for folks that they can post in the window. I agree with there was a mention, I think it was Nancy Doctor who mentioned that we ought to be doing some education about what the proper way to wear a mask is and what effective masks are. N95s are not super comfortable and really not effective if you're not fit tested for them. KN95s you can wear them without having been fit tested, and they are a tighter seal. Surgical masks also have effectiveness. I agree that we ought to be reviewing this at every meeting, that we ought to be considering carefully the circumstances of the state. And just looking at my notes, I think that in addition to our mask mandate, we need to, I agree, be doing as much as we can to help folks understand where vaccination is available, because we need to use all of the tools that are available to us. We need to increase the vaccination rates. We need to make sure that folks are getting boosted. We need to make sure that people understand that social distance and masking and vaccination all make difference. So that's where I stand. I really do appreciate the chance for a thoughtful conversation about this.
Other thoughts, comments?
I think it's important, I'm just throwing this out there, as Carrie just nicely summarized, the efficacy of various masks. Do we need to take it that one step further and specify which masks should, not mandated, but be implemented or suggested?
Heidi, is there any money that we have to actually go and order masks and have a mask handout?
I can try to find some money, but I know that we got an email today stating that we as a town can pick up some masks, and I know that Chief Barnes signed up to receive 1,000 masks, but I'm not sure exactly what kind of masks they are. But I can get back with that information.
Okay.
My point in mentioning that is that I think it's long been observed that the gator type things do nothing.
Right.
So that was my only point in bringing that up. And then it looks like the cloth masks are marginal, but even the cloth masks, you can put an insert inside of them on many of them that would improve their efficacy.
Oh, I have a quick update. I just checked the email and it looks like they are surgical masks.
There's 1,000 of them?
The town did that before.
1,000 of them.
I support Paula's friendly amendment that we make gaiters not part of this. The requirement would be for masks.
Yeah.
There are others who agree.
But I would agree, it should be surgical masks or N95s or KN95s or equivalent. And that specifically simple cloth would not meet the.
I don't think we can enforce anything.
Yeah.
Or make it just a recommendation that these are the masks recommended by the Board of Health.
Yep. I agree with that.
Ade, do you have any thoughts about this issue in terms of direction?
I think you guys made a fair point in terms of not making it an open-ended mandate. You can always visit it regularly. If we get to the low risk of transmission, then we can always resign it.
We had asked Jackie to sort of take notes during this discussion in terms of what kind of motion we would want to pass. And Jackie, I don't know if you're still working on it or you have it done that you could share a draft that we could do a little bit of editing on.
The
motion.
The one from earlier? Yeah, okay. Let me pull that up real quick. Sorry.
Regarding the mask inventory, I just want to add, Health has a little amount of surgical mask. If anyone looking for that, they can just stop by. And also we have some N95 respirator if anyone's looking for that. Thank you.
I think I know that a year ago or a year and a half ago, there was a run on masks and they were hard to find, just like rapid antigen tests are hard to find now. But getting masks now is pretty, they're in every store and they're readily available. At least the surgical masks are. Are you close, Jackie, to pulling that up?
Jackie's had to do a lot of multitasking tonight.
I'm sorry.
I am not sure why. It's not letting me do it right now. I am so
Okay. Let me see if I can find it. Hold on one sec.
Someone just delivered dinner to me. That was really sweet.
Oh,
I'm not
nice.
to be eaten from you guys, but it was really sweet.
Just looking at, I sort of took a rudimentary tally of the comments, and not that it should make any difference, but it was pretty evenly divided.
Okay, I have it. I'm just gonna put it on a new Word document here. Oh,
I got it. Sorry about that.
I was like 5 seconds from getting this on.
Sorry.
Okay, so the question is whether this is a potential motion to issue a mask mandate for all individuals to above. You can read it, except where individuals aren't able to use it. Would be reviewed monthly, beginning at our next meeting in February, well, a month from now, until the town reached the low or moderate transmission level as defined by the CDC, which time we would rescind it. Although we may decide to rescind it before then, we can always have that prerogative. And what I'm hearing is that we would want to add to this, that the that we would want to add that
The
simple.
board would strongly recommend either KN95s, 95s, and surgical masks as the preferred masks for use.
Can I make a suggestion?
Yes.
One, I wouldn't make it at 12:01. That gives zero time for anybody to prepare for this.
Okay.
Two, I would absolutely have this drafted by town council. We're meeting this Thursday night. We can simply add it to our agenda tomorrow and still be in open meeting law compliance with that Thursday night meeting, and bring up the motion to be voted on then. The one thing I learned from doing these motions on the fly through all this is it gets real messy and it gets messed up real easily. I have about 4 or 5 questions of looking at this one just as it's structured right now that I would definitely have town council look at. Simple things. This mandate will be reviewed by the board on or before their next monthly meeting, because that then gives you the opportunity to do it beforehand. As well, defining all indoor public spaces. So are we exempting privately owned businesses that have memberships per se, where people have to pay to get into it? Things of this nature would be, it's tough to do an all-encompassing one, or that if that's what you mean for it to be, make sure it's specified.
It's
But-
never a bad idea to have council look at it.
I honestly wouldn't do it right away anyways, just from the sheer fact of people aren't going to be ready for it. I think the majority of folks, when I'm in and around town and inside public spaces right now, they have masks on. I don't think there's an immediate need to put it at 12:01 on the 4th. I think we can do it for 12:01 on the 7th.
I'd be okay with that.
No, I guess I do hate to delay it, but
This is the part of having a 3-member board that I really don't like.
Yeah.
Because none of us could actually have discussed this fact and said, hey, go out if you're gonna have something, if you think you're gonna vote on something, have it ready and have town council look at it. We got to work on that 5-person board.
Yes.
Yeah.
I'm told that's still 2 years out.
Okay. The agenda got posted for the January 6th meeting. That would have
if we repost tomorrow, we'd still be in compliance.
Right, Tuesday.
I concur.
Okay.
I hate to delay, but I would rather delay and get it right than have to do it twice or more. So.
Okay.
Or amend it, which is what we did a ton of at the beginning of this whole thing. Yeah.
Right.
So I think what we'll do then is a day we would need to repost the meeting agenda for Thursday to include a vote on a mask mandate for indoor public places. And I actually do have a draft from that is much more detailed from another town that what I'm going to do is send that I'm going to send that around to the board members for comments back to a day and ask a day to coordinate with town council to incorporate comments from tonight's discussion, and anything when you see this draft, you say it should have this, it should have that, or I wonder about this. That way a day can take those comments back to town council who can review it, and we would have a document for Thursday night to vote on.
And so just around that as well, to Rick, make sure that you include what you intended to do, because town council will definitely want to know the intention. It changes the way they look at the wording.
Okay.
Absolutely.
Yeah. Okay, I think that's what we'll do, and we'll plan to vote on this on Thursday. I would want to, if we voted on Thursday, I'd want it to go into effect fairly soon. I wonder whether, we talked about, let me ask you, Kevin, in terms of getting a heads up to the community before Thursday, because we're going to we vote on this Thursday night. Now we're going into, a weekend, and people ought to be aware of our sentiments as expressed tonight and the direction we're moving, so that we don't have to say, okay, we'll make it effective Monday morning. Now we've lost even a week. And so what do you think about sending out an email to food and business establishments? I think Jean said that they have those listservs. Sending it out tomorrow saying the board had the discussion, this is what we're moving the direction of, we plan to take a vote on Thursday night. You should be prepared for this. And is that unreasonable to give a heads up?
No, not unreasonable. Actually, it'd be welcomed, I'm sure, by the community out there that's going to have to deal with it.
Yeah.
I think the consensus, as we can see right now, is that the 3 voting members are certainly in favor of putting any mask mandate pending seeing the verbiage of the actual motion, right? So I think you could probably put out a statement saying the Board of Health has intentions to vote in favor of a mask mandate at their Thursday meeting with guidance from Town Council on the motion, on the wording of the motion. I think something simple that at least that shows what your intent is to do, but you want to do it right. So you could certainly come up with some kind of press release like that. We've used Jane Wellman in the past to craft messages for her. She's really good at it. I'm sure a day could reach out to Jane and get her input on, how exactly you'd want to write that up. But I think it'd be certainly the right idea is to hit the ground tomorrow with at least what's going to happen and when. And if your intention's for January 7th at 12:01 a.m., then, have that as part of the written communication.
Sounds good.
Okay. Okay, so the plan then is to circulate a draft, have a day coordinate the responses of the board members for any suggestions, edits, questions, comments, have a day work with the town council in the next 2 days to finalize a draft, which we will vote on Thursday night. And we will update the agenda for Thursday night tomorrow. And a day, if you can ask Jean or Jane, or I know that there are these listservs or emails out there, and get out a communication, that what the intent of the board is, and probably it being effective for January 7th, so they have a heads up.
I will do that.
I think we don't intend to, other than make this motion Thursday night and vote on it, I don't think we tend to have another discussion per se, other than the motion. So with that,
To adjourn?
motion to adjourn, second. Roll call, Carrie,
Yes.
Paula,
Yes.
Rick, yes. All right, we'll see you all Thursday night.
Thank you all very much.
Yes,
Thank you, and thank you the
all.
public for participating.
Yes.
Thank you
We
for the
appreciate it.
work, Jackie and Ade and Schwung.
Very,
Good night, everybody.
very much
Night,
appreciated.
everybody.
Good night.
Bye-bye.